Can you hear me? Oh, wonderful. Hello everyone, thank you so much for joining us today. My name is Shorna and I'm the Head of Policy and Advocacy at Melbourne City Mission, and I'm absolutely delighted to welcome you here to the session Embedding Lived Experience in Policy, Challenges and Opportunities. As part of my role at Melbourne City Mission, I have the privilege of overseeing the lived experience practice and the advisory group, which some members are here today. So I am extremely delighted and honoured to be asked to facilitate this panel today. I can't see anything, so I'm going to look down the whole time. Before I provide some context to this session and introduce these incredible advocates here, I want to acknowledge, first of all, the traditional custodians of the land in which we work and live, and today we are on the lands of the Kaurna people, who are the First Nations people of Adelaide and the Adelaide Plains. I pay my deep respects to the elders past and present, for they hold the memories, the traditions, the cultures and hopes of Aboriginal and Torres Strait Islander peoples across the nation. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people here today. I recognise their continued connection to the land, waters and ecosystems, and thank them for protecting them since the beginning of time. Sovereignty was never ceded, and our freedom on this land is indebted to them all. It always was and always will be Aboriginal land. And as we spend the next about hour and a half talking about how we embed lived experience into policy, I want us to reflect on the impact that colonisation has had on Aboriginal and Torres Strait Islander people and the important role of self-determination. We know that solutions to our most complex problems sit within the communities we work with and the communities we support, and they hold depths of knowledge and expertise that benefits all our organisations and informing broader social and systems change. The approach of working with is a step towards humanising our practice approaches and helps us better understand the complexities that people are experiencing straight from the source. Stories and experiences are really powerful anchors, and they help us build connection and understanding, which I strongly believe helps motivate us to make the changes, the real change that we need to make. And therefore, I am very lucky today to welcome 7, unfortunately we've lost somebody to COVID, so they've gone home, but we've got 7 incredible humans who will share what has been learnt from including people with lived experience in policy and program design, and discuss how organisations can better embrace people with lived experience to work with them and to improve outcomes specifically in the homelessness sector and system. After the 4 short presentations, and then we'll be followed by a panel, hopefully we'll have time to take some questions from the audience. So first up, we will hear from Duncan, Bainbridge and Sonia, Masciantonio. Yep. Since 2021, Duncan has been a member of and is currently the co-chair of the South Australian Housing Authority's Lived Experience Reference Group, which is facilitated by SYC. And Dr. Sonia Masciantonio is the manager of SYC's Lived Experience Engagement Service, and you'll be able to find all the incredible work and the bios of these 2 people on the portal. Look.
Thank you. Hello. The title of this presentation refers to navigating a cultural shift. The cultural shift being the inclusion and voice and expertise of people with lived experience of homelessness into system reform, policy, service and practice. It's a new way of working for the sector in South Australia and requires a shift in power dynamics that have not been seen before in South Australian homelessness sector. It means facilitating the transition from traditional approaches to more inclusive, human-centred practices that value the insights and perspectives of people who have directly experienced homelessness. I'm Sonia Masciantonio, and I'm the manager of the Lived Experience Engagement Service, and I've been the manager since 2022. I'm the person attempting to navigate this cultural shift and embed lived experience into the sector.
I'm Duncan Bainbridge. I'm part of the Lived Experience Reference Group and have been involved with the LEE's work since its inception in 2020. I have intimate knowledge of the homelessness system that only a person with lived experience can bring. My role in the group is a system advisor, which enables me to utilise my experience, which is unique as someone with lived experience, Together, we'll give you a little glimpse of the work that we've done to date.
In October 2020, the South Australian Housing Trust, which was previously the South Australian Housing Authority, announced a 10-year reform of the housing and homelessness system. A vital pillar of the reform was to provide housing and homelessness services through an alliance model, a new way of delivering services through a joined-up approach that focused on early intervention and prevention. At the same time, the Lived Experience Engagement Service, or we refer to as LEAS, was commissioned to embed lived experience of housing and into the housing and homelessness sector. We've been doing this work ever since, and it's been quite the journey. As with any journey, it needed to start with a plan, something that would guide the sector on how lived experience can be brought into system reform. The first step in the journey was to co-design the lived experience framework for South Australia's housing and homelessness system. The framework provides a shared language and approach to this work, informed by lived experience expertise, representatives of South Australia's Housing Trust, directly contracted services and the alliances. The framework includes key definitions, enabling conditions, principles and functions of lived experience alongside practical resources that are needed to enable this work. The framework outlines how people with lived experience can participate, and in doing so, it will build understanding of people's needs and perspectives to improve experiences, build trust within the sector, and help people using the system feel more connected to the people delivering services, because there's true understanding rather than assumptions of people's needs and wants. This will ultimately lead to better outcomes for all. It was through the co-design of the framework that the Lived Experience Reference Group was first created, and Duncan is one of our foundation members.
Since 2020, I have reflected on my experience of unemployment, complex PTSD, addiction, housing stress and homelessness, and my interactions with the homelessness system. As someone who has first-hand knowledge of this system, I bring a unique perspective that can't be learnt from books or working in the sector. I can speak to the impact of policy decisions that shape people's experience. I use this knowledge to advocate for systemic change. Anyone who's travelled will tell you that if you want to know about any place, it's best to ask the locals. In a similar vein, those with lived experiences are akin to the locals who possess the intimate knowledge of the homelessness system. We have first-hand knowledge about the impacts of policy and the decisions that can speak to these experiences and what can be done to improve them. Our insights are like lighthouses, guiding the way and warning of potential hazards, ensuring a safe passage through the reform process. We're able to provide crucial input into discussion papers, policy advice, letters to ministers, and can create resources that enable lived experience participation. The inclusion of lived experience participation needs clearer strategic guidance from our funding bodies to ensure alignment with the work that we're doing for meaningful systemic change. Most recently, we were invited to represent the inclusion of lived experience lens in a statewide homelessness reference strategic group. This was an incredibly great step forward, finally allowing lived experience to have a seat at the table. Unfortunately, it was cancelled at the last minute and is yet to be rescheduled.
While lived experience is more mature in other sectors, such as mental health, alcohol and other drugs and disability, it is relatively new to the housing and homelessness sector, particularly in South Australia. The work we are doing is like sailing through uncharted waters, so we're learning and adapting to the environment as we go. It has been incredibly challenging work for several reasons. One is that we're working with a sector that is dealing with high rates of homelessness and a rental and housing crisis. Homelessness services work is focused on helping people in crisis, so lived experience work often takes a back seat, and services are not appropriately resourced or funded to meaningfully do the lived experience work.
I think you'll agree that lived experience work is built on trust and relationships, so it takes time. Projects don't always follow strict project timelines when working with people who can be traumatised by their experiences, and sector staff who don't have dedicated lived experience roles may not have the capacity to focus on this work. Adding to that, we've found it difficult to find people with lived experience who want to participate. We've tried many different methods and we'll keep trying.
While the Lived Experience Engagement Services remit is to work with the sector to embed lived experience, the maturity of lived experience practice for homelessness in SA is still in its infancy, but we'll keep trying. I feel genuine lived experience participation requires a significant strategic structural investment to enable its success. So the framework articulates the shift in power and decision-making that is needed to embed lived experience into the reform, where people who have lived and living experiences of homelessness are recognised for their expertise and are not considered drains on the system, but hidden resources that are valued. Lees has taken the approach of leading by example by initiating projects and having staff in specialist homelessness services involved in the design of research questions, developing resources to share with lived experience participants, involved in recruiting and referring participants for research, and also involved in interviews if they are interested. This has not been particularly successful so far for the reasons I mentioned earlier. The sector is dealing with crisis on a daily basis, and I feel they aren't properly resourced to support the lived experience work. In South Australia, I believe we have areas where consultative decision-making is working, so that's the second image on the scale. And there's pockets of participatory decision-making. But as you can see from the diagram, we still have a way to go to reach self-determined decision-making. Lived experience participation goes beyond merely having a seat at the table. It serves to amplify voices, influence systemic change, and empower those with lived experience to lead and drive and transformative change. Although embedding lived experience is the Lees' remit, it's not something we can do on our own. The sector needs to make a significant cultural shift in order to truly embed lived experience at all levels of the reform and embrace the true knowledge that lived experience can bring to service design, delivery, monitoring, evaluation and improvement activities. The ultimate goal is to reach a place where housing and homelessness are not just issues to be solved and managed, but challenges to be solved through collective effort and a shared understanding. The role of the Lived Experience Engagement Service is to lead the way, ensuring that every voice is heard and every step is taken with purpose and direction. We need to work with the South Australian sector to build their capacity for lived experience practice so they can join us on this journey as we can start to see people with lived and living experiences of homelessness in decision-making roles and workplaces that are inclusive and value the expertise that their knowledge brings.
We're united in our belief that lived experience participation at all levels of decision-making will guide us to our ultimate destination, a system that is inclusive, equitable, and informed by the needs and insights of the people who use it.
Thank you.
Thank you.
Thank you.
Hold on.
Oh.
Thank you. Is that on? Yes, wonderful. Thank you so much. Thank you for sharing as well, Duncan. I've just got a follow-up question. I know we've had a lot of conversations over the last few weeks, and I'm really keen for you to share why you think it's particularly important to have lived experience in policy and service design.
I think it's particularly important that we're involved because we're the experts. We're the ones that have been through the mill. We've been through the system. We understand and have attempted, sometimes successfully, sometimes unsuccessfully, to navigate that system. And it allows us to be able to provide advice and influence to those who are making that policy for the future of the system.
Yep. And I see people with lived experience as the subject matter experts, really, because, like you said, you've got the expertise of knowing what the system, the impacts that it has on you directly.
Wonderful. Yep. Thank you. And you're definitely making an influence and an impact. And I do encourage everyone to have a look at the bios of these two incredible humans. And Duncan, you're doing a lot. I didn't have time to share that with everybody, but I do encourage everyone to have a look. So thank you.
Thank you.
Thanks.
So next up is Chris Thirkell, is a graduate of the Council to Homeless Persons Peer Education Support Program, which in Victoria we know as PESP. And Skye Constantine is currently undertaking PhD research with, this is long, University of Queensland and the Australian Research Council Centre of Excellence for Children and Families over the Life Course. Is that right? Welcome. Life Course Centre. Well.
There you go. Thank you.
Excellent. So we're going to be reasonably brief, which makes it look a little bit like we didn't do our homework, but we think that there's more in dialogue than there is in us up here telling you what we think. So I'm going to be super brief as we go through. Chris will go into a bit more detail, and we're going to introduce ourselves a little bit in a moment.
Yeah, first I'd like to just acknowledge the Khan people on the lands which we're meeting today and pay my respects to elders past, present and emerging. And I acknowledge that the sovereignty's never been ceded. So yes, keep the good fight going and hopefully one day we'll have a treaty.
We'd also like to acknowledge that effects of colonisation mean that issues of homelessness and disadvantage that we're talking about don't affect people in Australia evenly. And while I want to acknowledge that there has been a recognition of the lived experience of the room in terms of the amazing contributions that are possible, I think it's also important for us to acknowledge that inequalities are not a fair distribution, and some people in this room are impacted by the issues more than others.
So I'll introduce myself. I've naturally, being a lived experience person, I have been homeless. I was homeless at the age of 47 with a 7-year-old daughter. Also my mother, who was 67, was homeless and had been for a number of years. We never thought of ourselves as homeless. We just thought we were waiting for a rental that never really came. But luckily we're housed now. And from that experience, I was looking for a purpose, something to do that's useful or purposeful and meaningful for me in my life. And I saw an application for the Peer Education Support Program at Council to Homeless Persons in Melbourne. And I thought I'd apply for that and see what comes of it. And luckily I got accepted into the program. And since then I've been doing co-design, I've sat on committees, reference groups, boards. I've worked in co-design and of a couple of lived experience frameworks and numerous submissions to government as an advisor. And I've been doing that for about 8 years now. And as you move from where I started, I just thought I had lived experience, but now I call myself an expert because I've been doing it for so long and I've learnt so much and gained so much knowledge over that time that I'd consider myself to be an expert now. Because I've got an enormous wealth of knowledge, not just from my own lived experience, but from my peers who I talk to and they support me. They've taught me a lot as well, and I've learned a lot over the time. But that didn't stop me from being very interested in Skye's research about how lived experience is perceived and used in the sector. So I'm going to hand over to Skye because it's been wonderful working with her on this research paper, and I'll let Skye introduce herself.
Yeah, but I said I wasn't going to talk too much. So just to position me, I've got brief experiences of homelessness in my childhood and early adulthood, but I never had to access services. And I think that makes a distinct difference here. My experience of services is about 20 years working across homelessness and social housing, and it has informed my experiences of current homelessness more than anything else. I moved into research because I had a bit of a question about why we do the things we do, and I saw consumer participation coming up as something that we were talking about, and I couldn't quite work out where that was different to the listening that I've been doing as just, you know, a kind of matter of course in my practice. And as I started researching it, I found that there wasn't a lot of data about what consumer participation was designed for, where lived experience was relevant, where living experience was relevant. So we ended up on a big collaborative project. So as I said, my experience looks at what people with lived and or living experience of homelessness believe need to be done to end homelessness in Australia, and how they see themselves being able to contribute to services and policy. I'm mostly concerned with what people with lived experience have to say, and that is the reason why I'm not particularly useful on this panel. There's a lot of information here that others can give you. There are a few things that I want to kind of draw attention to that come from my own experience going through this and working in collaboration for the last year or so with Chris and 4 other lived experience experts. One is that, as Tim from the Canadian Alliance to End Homelessness was saying this morning, homelessness is a housing problem. We know that in the data. Turns out that people with lived experience also know that. When we asked people with lived experience what they felt needed to be done to end homelessness in Australia, nearly unanimous response was housing is needed. And it was seen, we saw it as being represented as basically an obstruction, that the lack of housing was an obstruction to getting to the real knowledge that lived experience can bring to these spaces. So we do have a working paper out, co-authored on the Life Course Centre, pimp that out. So the other things I want to just kind of put out there are a couple of questions for us in the room who aren't coming to this to share our lived experience. The first one is, I'd like you to consider what it means to really listen to people when they're talking to you and really hear what they're saying without us putting our parameters on what there is as a solution, without us jumping to our understandings of what they're saying and what it means and what should happen next. And while I don't think we should jump to our understandings of what should happen next, I think we do need to think about what we're going to do when we listen to these voices of experience. And not just voices of experience, but voices of need. When people tell you what they need, listen to them.
I'm going to talk briefly about positive relationships throughout my 8 years of being in a lived experience role. I found that building good positive relationships, not just with the people I work with, but my peers that are also part of the team, building these really strong relationships so that we can support each other, share each other's knowledge, share information, learn from each other, discover strengths and weaknesses, to know and to build up that knowledge, so when you work together you can bounce off each other and go, well, you can speak to that and I can speak to this. So it's really important to have that full relationship where dialogue is open, there's no judgment, and you feel supported. And it's not just with my peers, it's also with my team leader, who did build up a really good understanding and good positive relationship with me, which helped me grow into my role as a lived expert now. Without that kind of positive relationships going on, I would not still be engaged in this sector, because it is pretty distressing at times. It's sort of a diabolical sector to be in. It's difficult. But with the support of both my peers and my team leader, it made me just go, yeah, this is important work that you're doing. You're making a change. You're making a difference. You're helping people. And that's because we had a good relationship. So, yeah, I'll talk a little bit more about that later.
Thank you. And And Chris, I think, it goes without saying as well that working with people with lived experience, we become so much better in terms of whether we're in policy or service or government. I think, it's definitely bidirectional, and the work that, I do with the lived experience group, I've just learnt so much. So I think it's definitely both ways. So thank you.
Oh, yeah.
I've got a question for you. So I think your abstract is referred to as, you can't ask that. So naturally I'm going to ask you, what can't we ask you right now?
Aha. Well, I've actually got notes for this. So my question would be that you can't really ask is there an us and them? Or perhaps is there a power imbalance between us and them? I would definitely say yes, there is. Sometimes intentional, sometimes unconscious, but it's usually based on a lack of awareness or knowledge that this comes about. And that's between both sides. It doesn't matter if it's us or them, we've still got biases. But if we build equal power relationships, there would be more knowledge that brings more understanding and awareness between people. You learn from each other. Sorry, I need water. I had this earlier.
You want to take any water off?
Yeah, I might. Yeah, thanks.
Thank you. Sorry.
No, take your time.
Sorry about that. So you learn from each other's strengths and weaknesses, their needs and goals. It's a two-way communication, and listening to help, it will achieve best outcomes for all people interested in that. Knowledge will arise, connections will be made, barriers will be uncovered. There will be times when one or the other person is in a heightened sense, which is what I'm feeling like right now because my voice is going. But with empathetic, open and supportive intentions, this can be calmed. It's important to build positive, power-based, equality relationships when working with lived experience people, be they clients, peer workers, or lived experience people. It allows for more broader understanding and opportunities and allows for better outcomes for all involved. Sorry for my voice. Ugh.
Thank you for your wonderful presentation. I'm definitely hearing about the importance of listening, but also action. And it's important to make sure that there is action after these opportunities to speak. So thank you very much, and I'll pick your brains in a moment in the panel. So next up, we have Ian Campbell, who is a lived experience leader and co-founder of Street Up, and part of the Lived Experience Inclusion Project initiated by Sunshine Coast Council. And PJ Humphreys, who is also with the Sunshine Coast Council, is a community development worker. Welcome.
Hi.
Hi everyone, we're PJ and my friend and colleague here, Ian. So I'm a community development officer with Sunshine Coast Council.
I was homeless when I met PJ and have been involved in a program to bring lived experience into policy discussions.
So we are here visiting from Cubby Cubby and Junibara country on the Sunshine Coast in Queensland. And we just would like to acknowledge the warm welcome that we received coming here. So the Sunshine Coast, for those who don't know, most people will know where Noosa is when you're wanting to escape cold in the southern states. Sunshine Coast goes to the kind of Noosa border, really, from the Caloundra to Noosa. So we're 100 k's north of Brisbane, thereabouts. We're a relatively large region and a population that is one of the fastest growing LGAs in Australia. It's a pretty nice place to live. Though it is pouring with rain at home, actually, and incredibly windy, so this is kind of nice to be here. In terms of our homelessness situation, it's increased 54% since the 2016 to the 2021 census. So really consistent with that regional trend of homelessness being experienced more and more in the regions. So this slide is just to give you a bit of context about how the Lived Experience Inclusion project kind of got started, really. And when I started in the role in 2022, early 2022, I was fortunate just to be given the space to really listen, talk to people, understand the context, see what was going on. It was a really kind of pointy time in the homelessness crisis for us, around that kind of really part in the pandemic when people were moving to the Sunshine Coast, but people weren't leaving the Sunshine Coast yet. So that housing availability was really, really tight. And the Sunshine Coast has had a low rental vacancy rate for years and years and years, and has continued to. So it hasn't been healthy for a long time. So I was hearing that we really needed to raise awareness in the community around the breadth and depth of homelessness that we were experiencing on the Sunshine Coast, and that we needed people with lived experience and living experience to be telling those stories. But I wasn't seeing where that was kind of happening. There were 2 community centres that I was working closely with that were doing lived experience inclusion work, and Ian was involved in one of those, and that's how we very first met. I then came to the homelessness conference 2 years ago in Canberra and heard about the peer education support program. So this is kind of a bit of a full circle now, because kind of taken away and connected with Council to Homeless Persons, and we've actually met with Chris a number of times online to learn about that program, and we have put something in place on the Sunshine Coast where we've really kind of modelled and just learnt from the peer education support program. So people often ask me, given that this is a local government initiative, how did I get it across the line? How did I get it funded? How did I get it supported in council? And I have been very fortunate that I've had very good leadership and leadership that understand community development practice and didn't need me to tell them what was going to happen at the end, and that they trusted an emergent process. So I was very fortunate in that way, and I kind of firmly believe that you've got to kind of make hay while you can, really, when you've got that kind of support internally. There was a concern around the value for money from one of my managers, but now that we are kind of gone through the pilot program and we're kind of into our next phase, and we've got 6 new people going through training right now, it's just not even a question anymore. But I guess this picture is about our community strategy that we have, and that has been very, very helpful to get it across that line and have that alignment internally of a strategy that it connects to. And since we've been doing this work, Voices of Lived Experience are embedded as an action in our Housing and Homelessness Action Plan. And it's Ian's voice and other voices that have influenced that and other actions within that action plan. So this is the kind of the phases that we've gone through in the pilot. The very first kind of step was scoping and design. So yes, I heard about it at the last homelessness conference. I went back to the Sunshine Coast and I just kind of posed some questions and started talking to some people. Is this something that we could do here? And I heard yesterday in the other lived experience group, if you've got a project idea, maybe talk to people with living and lived experience right then at that idea stage. So I'm glad to say we did do that. And Ian, I'll bring you in here. What can you remember about that, or what would you like to share with people around when we first came and had conversations with you about it?
I had connected with the local community centre in Caloundra, and we'd had some floods there in 2022. You probably would have all heard of the Lismore floods, and we had similar, but not as bad. And after that ended, there was some funding made available to in disaster resilience and recovery. And I, in conjunction with the community centre, conducted a survey of homeless people about how they handled the flood situation. We had three weeks of constant rain. I was living in a van at the time. And from that survey, PJ was behind the scenes, but I hadn't really met her then. But then she came up and I was approached about this program, this peer leader, I think it was at the time we called it, and we had discussions about whether the word leader was appropriate, and we've had plenty of discussions about whether expert is appropriate as well. I don't yet consider myself an expert, although I have plenty of experience. We had a pilot, we had a couple of co-design meetings. I mean, PJ had a model based on the Melbourne experience, but people who were interested, I and others, were involved in the design of the program that we went through, the training program. We were given some training in public speaking, in being trauma aware, because I think everybody that I've met, and certainly myself, has been through some kind of trauma. Anybody I've met who's homeless has some in the background somewhere. And then we, we did some education about the power structures in Australia, which governments are responsible for what. We looked at our local area and the type of housing that is there, and the number of houses that have 5 or 6 bedrooms and 3 bathrooms and 2 old people living in it. Not that that's a major issue, you can understand
or
why,
a couple,
perhaps.
or a single person.
Yeah. So there's a bit of wealth on the Sunshine Coast now. The local people are kind of being priced out unless they already own their home. And work is not particularly easy to get. There are plenty of people there who are working and living in their cars and, finding it difficult, things like that. So the program went for about 18 months, and then we've had a few presentations, maybe 20 now.
I'll go to this one. You can talk to that one.
Yeah, okay. So we've spoken to other councils in our area, like Moreton Bay Council down at Caboolture, which is south of us, and the Noosa Council, which is north of us. And we've spoken to library staff, the Parks and Gardens guys, the local law enforcement people. And
do you want to share some of those stories that we were talking about this morning, about when you've talked to the library staff, what some of the...
Well, like the library staff often deal with homeless people. There are a lot of people who go to libraries to power up their phones, or some of them go there to sleep because sleeping outside at night can be particularly unsafe, and so they don't get to sleep. And I had a bloke who came up to me after one of our presentations and said that it had changed his perspective about some of the guys who were sleeping on the desks. And also, like, there were people sleeping outside the library, and he didn't ever, previous to our presentation, he didn't ever have any exchanges with them, didn't connect with them at all, and afterwards he began to. So it really mellowed and humanised the situation. We've also had from Caboolture Council, we've had people who have, they change their local laws without moving on. They don't move on people anymore. They go there and ask them to engage with the various services that there are there, and they might take them a bin if they're camping in the bush, or they leave the local facilities open for 24 hours, so they don't like to publish it because there's always a fear of vandalism. But I think you find it's not the homeless people who vandalise the facilities. It's,
So I might just jump in there,
Yep.
Ian, and kind of just elaborate on that, because the City of Moreton Bay that Ian's talking about there invited Ian and 3 other lived experience leaders that we've been working with to be one of their stakeholder groups for their development of their housing and homelessness action plan. And they travelled to the Sunshine Coast to meet with them. I think they allocated an hour and the focus group went for 2 hours, hey?
Please.
But what was really helpful was that City of Moreton Bay provided written feedback about what they had heard and how that had been incorporated into their action plan, and they also did a Zoom meeting with us as well to do that in an oral way. So they gave that feedback written and verbally, and I know that feedback loop is really important in terms of not just obviously turning up and giving your input, but knowing that it is actually being listened to and implemented in some way. So Ian's been speaking to some of the presentations, which has been incorporated into staff awareness training. There's been a number of different consultations that they've been engaged with, and developing of resources. So we just launched a homelessness video last week that we made with people with lived experience. I'm just going to go back to this slide because this is the structuring phase that we went through as part of the lived experience inclusion project. And we could have set up an advisory group or a reference group in council, but we really wanted the group to have an independent voice, be supported and facilitated by council, but not owned and kind of regulated by council. So when we got to the structuring phase, which I kind of allocated 3 months for, but it actually took 9 months. And we formed a co-design team, which is made up of 2 people with lived experience, myself, and 2 of our community centres that have been integral partners throughout the whole pilot. And Street Up is the name that has been co-designed together and was launched on the Sunshine Coast last week during Homelessness Week. Skye was actually on our panel alongside Ian and I and one of our other lived experience leaders. So you can check it out. There's a website, streetup.com.au. So would you like to share what some of the personal kind of outcomes or benefits have been for you?
I don't like to talk about myself. It's not about me. I've been saying that right from the start. But in fact, at our launch the other day, we had the local mayor, and she said, well, it is really about you because you're the one who's here. So I guess I accept that. I became homeless after I lost the sight. I was in the building industry and lost the sight of an eye, and then cracked my back and was probably partially paralysed for about 18 months on some pretty heavy painkillers, and got into an addiction which took 5 or 6 years to get rid of. And being homeless, there are quite a few services on the coast as far as community meals go. And I used to go to many of them, and I met plenty of homeless people. And I'm the type of bloke who says g'day to people, and even people who wouldn't talk back. I used to continually say g'day, how you going? I'd find out their name, ask them how they were going. And when we did the survey about the floods, that was a good way of connecting, of me expanding a network. And, you know, people started calling me the voice of reason, because when they were using 3 points of ice at a time, you know, I'd say, well, you probably only need one or half of one, you know. And so, yeah,
Yep.
okay. So, I mean, but I wasn't really connecting with those people because I'd got over my drug scene. I wasn't a big drinker, and so I didn't spend a lot of time with them outside of the meal kind of area. So I became a bit of a loner. And being involved in this program has, I mean, I also had some years of tertiary education, although I didn't finish it. And, you know, I read a lot. I don't talk football or cars and that's what a lot of the people in that field kind of are on a fairly superficial, well, I don't know, I'm not going to criticise, but it just wasn't my scene. And getting involved with people in this situation was intellectually challenging, it was interesting, it gave me something to get out of the van for, you know, and quite humanising. And the whole process has been absolutely wonderful. And 12 months ago, I would never have dreamed that I would be in a place like this. Mm-hmm. So it really has been, for me, it has been quite broadening. It's, you know, giving me kind of something to hope for in the future, something to work for.
Thank you, Ian. I think that's a nice place to end, don't you?
Thank you.
Thank you so much. Thank you, Ian.
We obviously didn't get through all our slides, but there's the website.
And please go to the website. And I just wanted to congratulate both of you for, you know, for getting for getting it up in local council and for starting straight up and for being an incredible change agent. Really, I heard law reform, I heard policy reform, I heard service design. There's a lot there for someone that's not a leader. So congratulations. Or an expert.
Thank you.
And finally, but not lastly, Alan Earls works for the Salvation Army as a lived experience peer and sits on the Justice and Equity Centre, which is formerly Public Interest Advocacy Centre, on the Homeless and Mental Health Agreement 2022 Lived Experience Advisory Committee. And unfortunately, Charmaine is unwell, who is working with you, but you'll be able to cover both. Thanks. Welcome.
Hi, everyone. I chose last. It's like the wedding feast at Cana. They kept a good wine till last. I'd like to thank everyone that contributed to this conference. It's my first one. I found it really, really good. I'd also like to make special mention to all the lived experience participation. It was, for me, it was really emotional listening to some of the stories, but even the stories that we had in the coffee rooms and stuff like that has been stuff that I can bring home with me as well. So thank you very much for people who have shared. I'm only a lived experience expert in my own life. I'm not an expert for lived experience. I'm just, you know, I'm an advocate for lived experience. So the Housing and Mental Health Agreement 2020 is a collaboration between Homes New South Wales, which was DCJ. I don't know why they want to change their name, but anyway, maybe there was some tarnishing of it, but Homes New South Wales and New South Wales Health, and at that time the Public Interest Advocacy Centre, which now is the Justice and Equity Centre. I think we're there to maintain integrity in the project, to hold people accountable. And for me, you know, when I first saw the expression of interest, it was sent to me by an ex-colleague and said that I might be interested in it. I'm a bit cautious around getting onto committees. You know, you just don't know if the outcome's already chosen already, you know. So I think because it was with the Public Interest Advocacy Centre, I was really stoked that they actually accepted me, you know. And just for relevance, you know, 4 years ago, I was sleeping on the streets of Tweed and then Sydney, Coolangatta, the Gold Coast, you know, and we've heard some stories of how people are stigmatised, the rejection and the hurt that they feel when they rock up to places and try and get support. You know, I've struggled with some of them judgments as well. You know, I've been told I'm not making enough of an effort, you know, and I remember on one occasion I think I tried to take my life 3 days beforehand, and I was like, I'm here, you know, that's the most I can do today, and but it wasn't enough to get temporary accommodation that night. You know, I've been told by another service I'm just a middle-aged man having a midlife crisis, you know, and that was on intake. I knew it takes a bit of a, I'm like a sponge, it takes a few weeks before my resentment builds up, but I knew I wasn't going to last there because it just grinded on me, you know. They'd already judged me, you know, they had no story behind it, you know. And for me, homelessness, you know, I've heard people talking at the conference and I've heard it at other stuff where they've thrown out this phrase, and I liked it and then I don't like it. Rare, brief and non-reoccurring, you know. That's not my experience. I really hope it is rare and brief, but I also struggle with addictions. And, you know, I feel that homelessness is something like my addiction as well. You know, I was homeless in Ireland at 18. I was homeless in the UK at 20. Spent 7 years in the British Army, and when I came out I was homeless in Spain 6 months later, and across Europe, you know, and you know, sleeping on the streets. And then, you know, a breakdown of a relationship in 2014, 15. I ended up homeless here, you know, so it's like my addictions. It's been no different. It's just something that comes up. So, you know, if someone was to say to you that, you know, we're going to cure your alcoholism, you're going, I don't know about that, you know. But I would hope that we can keep it rare and brief. I only wrote notes because Charmaine's not here, and she would have kept me accountable, you know, and brief, and not go rogue, and, you know, so yeah. You know, those things that I spoke about, that stigma and that shame, you know, that's why I'm happy to jump on this housing and mental health agreement. You know, I work as a peer worker. I worked 4 years ago when Tweed heads DCJ said, no, you're not making enough of an effort. I rocked down to Sydney because I was familiar with services there, and I think we're very blessed with services in Sydney. Rocked up to DCJ there, thought, yes, happy days, no, you don't meet our criteria, you've just come from Queensland. Because I think I was sleeping about 2 streets away from bloody New South Wales, you know, at the TAFE in Coolangatta. But I knew that there was a drunk tank in Salvos. Well, it was called KP. So I rocked up there at 4 o'clock and stayed there that night. And then thankfully the next day they interviewed me and I got case managed, you know. And for me, the best thing out of COVID was the Together Homes program. I was a recipient of that. I've been in the same housing since. It's the longest housing I've held since I was in the army, like over 30 years ago. Do you know, like it's such a great program, so good that it's not been refunded, which is, you know, it just talks about, you know, where we're at sometimes, you know, because we're looking for better solutions, cheaper solutions, or where we've got a housing crisis now, but I think we've always had a bit of a housing crisis, you know. You know, and that program for me, the wraparound was the important bit. And I think the wraparound is like, you know, a person going to a 12-step meeting, you're catching up on the phone or face-to-face with a case coordinator on a regular basis. And, you know, you can step up or step down, you can utilise them more. I think for me, that's the game changer. And so whatever solution they do come up with, if there's no wraparound service, you might as well forget about it. We're not setting people up for success. And that's what the housing and mental health agreement is. You know, while I was in the Salvos, I applied to, because my background is in finance, and I've had a few careers, you know, but yeah, I applied for a job with health because I just thought, I've never had a job interview, so let's find out what it's like. And I ended up getting a job as in a co-design and implementation of a new service for New South Wales Health called Towards Zero Suicides. And I ended up being a peer worker there, you know, and because of COVID, I ended up working in mental health units as well. I've stayed in mental health units. I've done multiple rehabs. I thought all the rehabs over here were so bad. I went to Ireland, went to England to another rehab, but it's not. You know, the disease is in here sometimes, you know. But I saw how pathways of care and when people are exiting institutions were created. You know, you see people going from involuntary to voluntary because we need the bed. You know, you see because someone stayed in a boarding house before, let's send them back to a boarding house. Or let's get them 7 days in TA, and that's the pathway. You know, that's, you know, I don't think that's treating people as a human being. And so with the housing and mental health agreement, the idea is that we're going to build better pathways, we're going to suggest better pathways. Right now, I didn't even know we had slides, but anyway, yeah, there we go, that's slides. We've done lots of stuff. But yeah, so, and it's important that we have an input to that. Right now, like the great thing is there's about 8 or 10 of us, and we all take turns. It's not the same person every time rocking up. Like, I'm not going to be here next year talking about Hammer. There has to be somebody else. We need to be bringing everyone else along as well. We can't be rolling out the same usual suspects. It happens in mental health, it happens in suicide prevention. If we're building a new peer workforce and lived experience workforce here, we need to be bringing people along and upskilling them. And that's the great thing, you know, that is with the Justice and Equity Centre, they give everyone an opportunity, you know. And, you know, right now we've presented a statewide committee with New South Wales Health and Justice Health and DCJ and all them. But, you know, I don't think, you know, the opportunity for us is presenting to local and district New South Wales Health decision making. The opportunity for us is to get in at grassroots. The decisions are made by the time it goes to the statewide committee, and we sit in there and then we read the papers and we give some feedback. You know, the opportunity is that we are part of that decision making, even if it's at a case management. You know, I suppose my hope for the future that something like with Hammer, and I haven't told anyone else this probably, but is that, you know, we have official visitors in mental health units. Why can't we have an official visitors around holding institutions and organisations accountable around how they exit clients from jails, from hospitals, because they are the most vulnerable. You know, in the first 30 days of coming out of a hospital, you're at your most vulnerable. Suicidality, addictions, homelessness. You know, to be honest, I think it's the same shit, just different buckets. You know, and we really, really need to make sure that we set them up for success and we give them those wraparounds. I've actually spoken about nothing I've written down about. So let me just recall and then I'll finish up because, yeah, okay, I'm going to throw, no, not grenades, but I have some pet peeves, you know. Lived experience, I've been part of different lived experience groups, and if there's people who are on lived experience group or organisations that are trying to get them together, make sure they're involved in the terms of reference. Make sure the terms of reference are dictated by lived experience as well. Make sure that it's not a monthly barbecue or quarterly LEAP, LEAGs, that we've all got these acronyms. You know, put a bit more. I'm very fortunate that, like, I'm working where I was living 3.5, 4 years ago. But our model of care has lived experience right through it, you know. I've worked for other organisations, they don't. You know, they've got lived experience peer support workers. There's opportunities there. You've got to start building opportunities. Looking at your ex-clients and your ex-residents or whatever it is, and finding the ones that actually want to step up. I heard people talking last night on drinks. So yeah, I'm not going to name you, but like, we can't find funding for peer work, right? You got support workers. Why don't you make designated positions for lived experience and see how that goes? And you'll see the value, because they'll bring so much gold. Someone else said it in the thing. We're a resource that you can tap into. Don't just tap in on once a month or once a quarter. Have them in your organisation and tap in on a daily basis so you get better outcomes on a daily basis. And that's me. I'm going to shut up. Thanks very much.
I just wanted to thank you, and thank you for sharing parts of your story as well, and that, you know, the importance of peer work as not just life-changing, but as saving and raising that really important point around discharging from institutions into homelessness is something that our country is struggling to address at the moment. So thank you.
No worries.
And I'll
Thank you.
So now I get the pleasure of picking your brains a little bit more in terms of the work that you're doing. So we'll just start from this side.
Sure.
So firstly, I'm keen to understand, and then anyone else can respond after Sonia as well, how do we move from strategies and frameworks to actually, actual lived experience engagement that's not tokenistic?
Well, I would like to see people with lived experience involved at all levels. So from board members, people in leadership, people in peer support roles, people involved in advisory groups, just more embedding of people with lived experience in the services, because currently I feel like we're trying to do a lot of it on our own, and I feel like the services could do more if they had the financial backing. Yeah, so there needs to be a structural investment to make that happen.
So that capacity building across rather than just that one team or one group within an organisation.
And not just one person on an advisory group. I think that's awful to just be having one person that isn't having that kind of support. I remember when we spoke, Chris, initially, you talked about how you often went out in pairs to do those engagements. You weren't kind of alone.
I'm going to take that even further and say, the experience of, and it's in a research context, but the experience of being an institutional researcher with 5 people with lived experience, the immediate, our first meeting, for me, the experience was that I had to sell myself to this group who knew their stuff. I had to show that I knew something that was worth them working with, rather than that kind of dynamic of well, this is what we're going to do. How are you going to be useful to it? So I think, flip it where we can is really important.
That worked very well too. And you did sell it rather well, by the way. But yeah, it definitely is like, that's the thing about, in my position as a lived experience person, you do get the opportunity. You can always say no. It's your choice, it's your time. If somebody says, hey, would you like to do this? You can say no, and that's an important part of being in a program with lived experiences, being able to say no. But we couldn't say no to Skye because her research was so important. And looking forward to hearing more about it, actually.
Alan, I might just go to you in terms of your experience across both the mental health. It's a lot more, I guess, advanced on the journey. There's always more to learn compared to the homelessness and housing. Have you got some?
Yeah, I think we've got to be mindful when we're bringing lived experience onto committees and all that kind of stuff, is that what other stuff are they doing as well? We really need to learn as well from, I've been on groups and we need somebody from the Aboriginal background, we need someone from LGBTQIA+, and it's like we're ticking boxes there. And we're putting extra pressure, some organisations put huge pressure on people who self-identify to do that and be that, So if you're the only person in that organisation, it is hard. And that's when we need to start bringing in reasonable adjustments, to make sure that the workplace can meet and support them when they need to take that time, because, I can still get triggered. People are sharing their stories that's very similar to mine, and if my practices aren't good enough at the end of the evening, or if I'm running a bit rough because I got my own stuff going on, I need to take that time out, so yeah, just be mindful that lived experience is great. We need to incorporate it, but do it with intention. Do it with intention.
And care.
Thank you, Duncan.
I think the big thing is getting people to say yes. It's all well and good envisioning lived experience inclusion across the board, but it's getting the people with the lived experience who are prepared to give their time, give their advice, give their knowledge, and impart their heart to something which they may or may not see the results of.
And I guess just to add to that, I think it's really important that people with lived experience are fairly remunerated and valued and supported in their roles.
And I'll also add to that making sure that people do see the results of what they're putting in the work for. And I think that I think it's good. I'm hearing a lot of conversation about feedback loops at the moment, which is really good because that was missing previously. But I think that beyond feedback loops, we need to be having real conversations around what are the priorities of people with lived experience and people who are accessing services for those services in terms of what they're providing. I don't think we ask enough what people actually need to receive and then design around that.
Shorna, can I just add one more point? Because it was part of our presentation, which we didn't get to. But in terms of that embedding lived experience, not beyond frameworks and strategies, some of the core kind of components that we've learnt as we've gone through is 3 key things really to set up for success. Setting people up with living and lived experience for success, to be involved, has been educational support, emotional support and financial support.
Wonderful. It really simplifies it, isn't it? The resourcing is really important, and we need to work out how to systematise that as well. Thank you. Before we move on, Ed, did you want to share anything about how we can move from framework or strategy to doing?
Look, I don't think it's easy. The stereotype of homeless people being drug addicts and alcoholics and traumatised and going off is not a fiction. We had, when we started our group, we had 6 people, and now we have 2. Two pulled out because of other things that they were involved in, so that was quite fair. But two guys pulled out. One because he was kind of involved in something else, but the other guy was just completely non-group ready. He had just barely suppressed tension and anger, and it was within 2 or 3 of our first sessions that it came out, and he started abusing one of our participants, So,
we learn a lot from that.
Absolutely. And I mean, there've been people that I've wanted to bring along, and we had a second kind of a tranche a few weeks ago that we've started training, and people that I thought would be good in that area have, regressed. I don't know. They didn't see the hope or the benefit of it, and have continued in their kind of traumatic existence, which is, I've been there. I know what it's like. It's really hard to break out of. But I think if some of them had joined in this program, it would have helped them enormously. So, and again, the emotional, financial support. I mean, I would have to drive from Caloundra to Nambour, which is probably 30 k's and back, and that's an expense, the petrol and stuff like that. So, you can't expect people to do this kind of stuff without giving them some remuneration. And then if you're calling them experts, then you might as well pay them like an expert.
I think, just on that, I think that that's one of the things I see, that lived experience and lived expertise are often used interchangeably in this space. And I think it's important to think about what we actually mean by the words we use. So I like that I'm seeing more talking about lived and or living experience. There are differences in terms of the experiences of people who are going through the homelessness system as it is right now, in a cost of living crisis, in a housing crisis, in the midst of it. There is a difference between lived experience and lived expertise as well. There is a need to to think about how expertise is being nurtured and supported. I think not everybody's interested in developing expertise.
Yeah. And I think, we jumped. That was one of the questions, so thank you for jumping there. We might jump. No, that's great. And I know we've had lots of conversations with Chris and Ian around that, the difference and the journey from lived experience to lived expertise. So maybe if you wanted to share a little bit of what we've been speaking about.
Yeah, well, I think, while you're living in it, you're just going day by day. You're kind of in survival mode. You wake up in the morning and it's, where do I go to the toilet? Where do I have a shower, and then where am I going to get my next meal? I was on a disability pension, which is a little bit more than, I'm still on a disability pension. It's more than job seeker, and so I guess I had more funds, but the fact that I was living in a van meant, and that council was quite happy to move me on, it meant that I had to drive every day somewhere. I had to go to the shops. I didn't have a fridge in the van, so you've got to go to the shops every day. You sleep somewhere else at night. You can't camp by the beach or lots of places. So it's not like I'm spending all my, because I'm not paying rent, I'm rich.
Can you talk to me about the educational support, how that has helped inform your lived experience?
And also I think I've said that while you're living in that thing, you don't have time to reflect on it, and then you can't become an expert until you have the time to reflect on what you've been through. And for me, it's really only been with this, with the communication between people, we had a social worker who would ring me up after presentations in the evening and say, how are you going? Was it all right? Stuff like that. So, and kind of being involved in, I was on the housing list since 2004, and I got a unit the week before Christmas, last Christmas. And since then, it's in a different stage now, transitioning into housing, but I am more secure and I've had time to reflect, and so I am becoming more aware of the issues and more confident, to appear at a place like this. And so, it takes a while. Somebody who's been living on the street for a while is not going to be, able to switch over instantly to be a reasonable, normal, communicative, intelligent kind of person, because they're not living like that.
Well done. Well said.
Yeah, I've actually noticed that because of the people's living situations, that often can make them unable to participate in any meaningful form because they're just so busy surviving. But then you do get the time when people are settled a little bit and have calmed down a bit in their lives, and that's when you can engage these people as a lived experience voice, and as an advisor and an educator and an advocate. But then after a while, as you go through the program and you start doing more different various things, and you read a little bit more and you gain more knowledge, that's pretty much when you can say you're a lived experience expert, is when you've been at it for that long that you can actually operate totally on your own, although I was choking to death before. But honestly, it's just my throat was trying to kill me. But you can actually stand on your own 2 feet and do things, and that's when you can become an expert and you use all that knowledge and history. But it takes time.
Yeah.
And understanding and sharing of knowledge.
Wonderful. Duncan or Alan, did you want to?
Yeah, I totally agree. When I first got involved, I was just very early days of recovery, but it gave me something to focus on, and it gave me structure, and it gave me something that I became enthused about because I could utilise my own understanding of what lived experience was, and then suddenly I was meeting people who were coming from slightly different points of view but had the same common purpose. And I think that's where focusing the channels of people's lived experience is essential, and when you do that in the correct way, great things can happen.
I think I would say is, Duncan mentioned 12-step there, or recovery, whatever. They say in 12-step, don't make any major decisions in the first 2 years. Becoming an advocate is a major decision. Stepping up, we can, I also run a charity that's a drop-in space on the weekends. It's all volunteers, 25. I've got 25 volunteers with lived experience of suicidality and mental distress. I've had to tailor when they can do shifts based on how they're travelling. I've had volunteers end up back in mental health unit. I've had volunteers end up in quite distressing situations, going through their own stuff. And, it's for them, even though they think that they're able to do it, it says in the big book of Alcoholics Anonymous, page 164, you can't transmit something you don't have. So if we are sitting beside someone, trying to support them and encourage them and hold the space, if we're not travelling well, they'll know. They'll know. So we've really got to make sure that opportunities, you can step back, you can say no. No is an answer, full stop, and just leave it at that.
Thank you. I've got one more question from myself, and this is probably more for the researchers, but anyone can jump in as well. In terms of evaluation, how do we evidence real change compared to a nominal commitment or tokenism?
You can go first.
Oh, that's a really big question. Look, I'm gonna be a real pain in response to that. So the research I'm doing currently is looking at lived and living experience and its potential to influence services and policy. As I said earlier, I came from working in this for 20 years. I thought I knew the worst of the sector, and through doing interviews with people with lived and living experience and hearing about their experiences, I guess in a completely unshaped way. Like, I wasn't asking them for the purposes of providing services or for, kind of moving through that. I heard stories that were worse than I expected to hear. And so I think that in terms of evidencing impact of this, I do think that there's a real challenge for the homelessness sector to, I guess, kind of have a really critical look at itself and get some of the basics right. Like, look at is the sector kind of fulfilling its basic aims? Like, is kind of like that basic level of, this is what we expect somebody to receive when they come to our services. It's the point of why we're there. I also think that beyond that, we're in a context where we've got the sector has a lot of accountability to funding bodies and government and regulation and the like. I think to really measure this impact, it means having accountability in a holistic way, having accountability to lived and living experience, and I'll just kind of piggyback on the end of that while I agree about lived experience advocacy is a big decision and a really amazing, brave task that people have taken on and thankless sometimes. I think that for the rest of us, we need to think about how we're able to listen to all people with lived and living experience, whether they have the capacity to advocate or not.
Thank you, and thanks for the reminder that we're all here so that everybody can meet their basic human right, hopefully, in terms of getting a roof over their head. So it's important that we have accountability to those people. Did you want to share?
I guess I'd see it as people like myself can kind of step out of the way, and people with lived experience actually are leading the change. Because while I'm an ally, I think people with lived experience should be in roles that are actually leading this change, because they can speak from experience and they can bring us along with their journey as well. So I'd love to see that happen. Yeah.
I think, Hannah is something new for Homes New South Wales and New South Wales Health, that collaboration. So that there's a change with Homes New South Wales. Not just a change in name, but there's a change of attitude. We've been involved in co-designing and the trauma-informed training for new hires and frontline staff as part of the HAMA Lived Experience and Street Care Committees. Other organisations are doing the same. Look, Homelessness Week was a huge success last week across the country, like definitely in Sydney, and that's driven a lot by lived experience as well, So I feel that there is a lot of change, and we've got to walk before we can run.
Mm-hmm. Wonderful.
Yeah.
Thank you. So now I'm going to hand over. I've got a few minutes or 10 minutes for audience questions. I cannot see a lot.
It's right down here.
Again. So if you can, if you wanted to direct your question to somebody, otherwise to all.
Thank you. Thank you very much. Deep, heartfelt thank you to the panel. Robin Martin from RMIT University. My question is, what sort of training do non-lived experience workers, educators, researchers need?
I think they need to first understand what a lived experience means exactly, and what can be utilised or resourced by that person. I think they need to understand also a bit about trauma-informed practice and trauma, just dealing with trauma. I think also they need to learn how to listen. So there could be training in how to actually learn how to listen properly, because often that does not happen. And so I think, pretty much learning what lived experience means in the first place, or living, or experience, or expert, or consumer participant, or advocate, or advisor. Just learning what you can get out of these people, because we're a wealth of information, and it just needs to be understood that that's the case.
Thanks, Chris. Duncan, did you?
3 things: lack of judgment, an open mind, and being able to listen.
Yep.
Is that?
Yeah, and I could add perhaps awareness. I'll give an example of a community meal that I went to, and one of the volunteers, and a lot of the volunteers are older women over 60, whose husbands might have died and they've got their super and they want to contribute, which is very good. And a particular woman was going out handing out loaves of bread and asked me if I wanted a loaf of bread, and I said, no, not really, I've got one. And she said, you could take it home and put it in your freezer. And I said, well, I don't have a freezer. In fact, I don't have a home. And she seemed to be quite surprised by that, but it was a community meal. I mean, most of the people there were homeless. And she looked at the guy standing next to me. I said, don't look at him either. He's not home. He still doesn't have a home either, So it took a while for it to sink in with her that most of the people she was dealing with were sleeping on concrete or in bus depots or, whatever. So I think awareness, the people who volunteer do a great, wonderful job, and I'm certainly never going to criticise anybody who does that, but perhaps the organisations who bring them on need to give them some awareness training, and maybe they could use lived experience people in that role.
Yeah. Thank you. Have we got another question?
Hi there. Just to take up what Skye was saying about being a thankless task. I'm here on a lived experience ticket. We don't have a college or a national body or anything, but I'm pretty confident that we thank you for all your work. Everybody in this sector, you've got lived experience too. I want to pick up on something Ian said about the expertise thing. That language in there, I heard at one of these that people say, we've all got lived experience. A phrase that I've found useful is, we're the primary stakeholders in this industry, right? It actually comes with a duty of care. Some people, if you've got to argue your case in your body, whatever it is, to bring a lived experience program in, maybe reminding those people of that will get it over the line.
Thank you. Have we got any more hands up? No. Well, I might ask one last question though and put you on the spot. You did say that I could. So obviously, you know, at Melbourne City Mission, we do a lot of work in the youth space. So I'm really keen to know how you're incorporating lived experience with young people, and if that's the case in your projects and research.
That's right. We did plan this, and that's where I just publicly fail on that one. No, the answer I agreed to give is that I've never focused on youth homelessness. That's not my area. I'm accustomed to working with adults, and that's what I look at. I think one thing that I'll say that I've been reflecting on as I've been sitting on this panel between us agreeing this question and now is there's not a great deal of diversity on this panel, and that can often be the case in these spaces. So I was kind of, you know, I've been sitting here thinking about, well, we're the people who put abstracts in and kind of went, hey, we want to talk, and we got put on a panel together. Possibly we need to be more targeted in who's having these conversations when we're discussing it in this way, so that diversity is included. What I was going to say in my simple response is there are some fantastic youth leaders in the lived experience space. So for me in particular, I had the incredibly good fortune of presenting with Simon Burns from Y Foundations in March of this year, who is a phenomenal lived experience, live expert nerd. And there are different groups that I guess are leading through in different ways, and I wonder, I guess I'm now kind of thinking about, you know, in the discussion around closing the gap yesterday, there was discussion around the cohorts that sit within these groups. And it is the case that some groups are going to have more in common than others, are going to have a different sense of what possibilities are than others. And I think we just need much, much more room for lived and living experience and expertise as well.
Wonderful. Did anybody else want to?
I'd have to say we're also guilty of not really doing a lot of work with youth, although we are looking at doing a project with some of the services that I sit on a youth strategic group, which hasn't taken off yet, but it's certainly something I think we need to be focusing a bit more on. I think youth in particular really have a way of being able to articulate what they need and, you know, work with some really good solutions, and I think it would be great to be involving them more. Yeah.
Great. Thank you, and we'll take that as a reminder to make sure that we include young people's voices in these conversations. I did want to acknowledge Uhuri for embedding lived experience across the conference. I think it's incredible to see these conferences every year, and this year in particular, there's been a lot of focus, and also with your comment around diversity, acknowledging that there's also panels dedicated to Aboriginal and Torres Strait Islander lived experience panels. So that was something really great to see as well in the conference program. So that's all we have time for. Thank you so much for an amazing conversation. I'm sure on behalf of everyone, we've learnt so much from all of you, and really looking forward to seeing how your work continues to, you know, cut new ground and do amazing things. So thank you very much. If everyone can give them another clap.